Thank you. It's good to be with everybody today. I want to just thank our previous speakers in conversation. They've set an incredible conversation with us as Edgar introduced really this triple pandemic of the economic, health, and racial equity challenges we're facing at this moment, and the collective exhaustion I think that the world is feeling, alongside Michael's real challenge for institutions to step up and carry this movement. I think it really allows us to enter this conversation with three leaders who are in institutions responding to a world that's changing around us, and in some ways with a bigger opportunity to make the world we envision. And I think at the same time, there's incredible pain, tremendous hope for the fight. And so I want to thank Trooper Kamal and Rita for joining today, and really start us with, these are leaders on the front line, thinking about how they're changing organizations in a context that has just changed tremendously, no matter what lens you're looking through over the last 6 months. And each of them are working at their organization to be responding to that change. So I want to start with a question for all of you, which is really recognizing this change that we've faced in each of your organizations. I have watched each of you respond with a level of speed and focus to really meeting needs. Can you tell us each a little bit about your organization and how you're facing this moment? And Trooper, we'll start with you, if you don't mind.
Wonderful. Thank you so much. It's so great to be here. Well, Benefits Data Trust has been around since 2005, and what's brought us to life is the fact that our public benefits programs that deal with everything from healthcare and education assistance, home heating assistance, food and nutrition, that these programs are simply too difficult, in some cases by design, in other cases just by the evolution of complicated systems and programs, are often too complicated for people in their everyday lives to navigate and get the benefits that they need to deal with really fundamental areas of human and life security, of eating enough and getting health care and making sure that your house is heated. And so over the years, Benefits Data Trust has worked with people to help connect them to benefits through a variety of tools, from direct service. People in some states can call us and we can walk them through the entire process, developing tools, be it technology or other types of things that can help people and help community organizations do this type of work. And then we also work with state government officials and others to improve the systems and make the current systems work a little bit better. And so it's important to remember that before the pandemic, there were already way too many people who were cut off from the benefits that they were otherwise eligible for. Even though the statistics might have pointed to being in a stronger and more robust economy, the fact of the matter is that there were many people for far too long who were being pulled under economically. And so we were working well beyond pace to help connect people to benefits. And then the COVID-19 pandemic came to our shores and the economy came to a dead stop. And I work with some extraordinarily energetic, mission-focused people who keep me on my toes at all times. And I'll say that despite the worries that people undoubtedly had in their own lives about their own safety, and schools were closing and other things, that my entire team from top to bottom did not miss a beat. And during the week when we really knew that the city was going to shut down, we had the ability to have most of our people who are not on the phones every day talking to people work from home. They could just take their laptops home and set up shop. But it was much more difficult for our extraordinary folks in our contact center who represent about half our organization. And if we were not going to be able to to continue serving people when the city shut down, frankly, not only Benefits Data Trust might have been out of business, but more importantly, many, many people would have gone without healthcare and food assistance. And I have to say that within 4 days, the team walked in the door on Monday with no plan. And I walked around the office that Friday. It was empty. It had meant that everyone was at home working and people were able to call us and get the help that they needed. And I'm just so, so proud of that.
Thanks for that. Rita, at Unidos, you've sat at the intersection of many things. So could you tell us a little bit about what you've seen and the transformation you've had over the last couple of months?
Thanks, Julie. Thanks for bringing us together. I too, really read what Trooper is saying and what Michael has said and what Edgar has said earlier on, and really resonates for me, because I think as an organization, as a civil rights and advocacy organization, we've been around a little bit over 50 years, and we're the largest Latino civil rights organization in the country. We've been at the forefront of really responding to not only COVID, but a number of different issues. And most of us may know us more on our immigration work and our civic engagement work, but we're really at the cusp of not only health and immigration and civic engagement, but also education and housing and workforce development, economic development. So as you can see, all the different pandemics that have arisen from all these inequities, is we were pretty much at that same structure in terms of really having to move very quickly to get into a space where, with some investments that we had made early on around technology, to be able to get on Zoom with you today. I think that was just a critical thing for us to not be able to skip a beat. What is hard for us, at the heart of our organization, is our nearly 300 affiliate organizations, community-based organizations across the country that provide millions of services to Latinos, from the food insecurity space to the housing counseling to economic empowerment to even the education and in the daycare centers that we're closing up and all that. So for us, it really was, really a major transformation for us to be able not only to lead in this space, but also where our affiliates were also looking for information from us as to what just happened, what is out there, how important it is, and inclusive to those organizations that we have, we also had federally qualified health centers. So health centers that are serving the medically underserved, that we're also seeing their offices and their services closing down because of essential services or not, and a number of different things. So I think for UnidosUS, we immediately reached out. I think we have a very community-centered approach to talk with our affiliates and have listening sessions to be able to talk with all our subgrantees, our program leaders, our community health workers, our promotoras, both in English and Spanish, to figure out what it was happening, how can we best support them. With these things, we were finding a couple different things. The challenges of delivering services and keeping employees safe. I think that continues to be a big issue, especially now when we're starting to see some of them having to open up again because of the decreased demand of services, the inadequate infrastructure in working remotely. Many of them did not have the cash in hand to be able to keep their doors open, or even the actual laptops to be able to work from home. The lack of information that we were not having in terms of Spanish information, the confusion, especially among the low income, the undocumented individuals. We really needed to step up and be able to provide a lot of that information as a trusted source. What we were starting to see early on, the exclusion of the stimulus packages and other relief efforts that were not inclusive to what we needed and what our community-based organizations were needed. And actually at the same breath was also the lack of information that we were getting, the lack of race and ethnicity data that we just were not necessarily was being out there. So one of the things that we really changed in talking with our affiliates, talking to the leaders, is really to support them and to set up an Esperanza Hope Fund. And our Esperanza Hope Fund is really to strengthen the resilience that already was embedded in the community, but to be able to help them navigate and better a new environment and a consistent environment. And these areas we focused on 3 pillars. The first one was making sure that we were providing the most accurate information out there around COVID. And that the basic information and the changing information that we were seeing, not only for them to be able to reach out to families and children and essential workers to better protect themselves. The second one was emergency assistance to families, being able to provide some support to the community-based organizations, to be able to provide them with some critical services and technical assistance. You know, a lot of our programs component and the policy components were providing a lot of specific technical assistance to, you know, how do you think about it, working with the foundations, working with our funders, working with our partners of how do we think about what just happened and the reality of it. And then the advocacy end of it, making sure that our voice was present, that we were being further left behind. So a lot of these initial activities is really happening to really support everything. I think the big issue for us was the commitment, not only from private and public partners, including foundations and corporations. It was imperative for our community-based organizations to continue to address the local needs. And so that, I think, alone was just the beginning of what we were starting to see. And what we knew already was major inequities.
Thanks, Rita. Kamal, can you tell us a little bit about Opportunity at Work and the transformation you all have been under in the last 6 months?
Yeah, absolutely. And thank you for allowing me to be on the panel with these wonderful individual and organizations who are very impressive. Where Opportunity at Work is younger than I think some of the other organizations, but we've been around for a few years. I've been at the organization for 2. And, you know, I'll start with saying, look, even before COVID, we were in the longest economic expansion in the US, right? But what was happening over the last 40 years is that the 60% of adults in the US who did not have a bachelor's degree saw a real wage decline by 13%, while those with bachelor's degree saw a wage increase by 8%, right? And so part of this is because we started putting a bachelor's degree requirement on jobs that we didn't used to require a bachelor's degree before. So that started closing people out of opportunities. So Opportunity at Work very specifically is looking at this population, has been looking at this population, and there's a part of this population we've deemed STARS, so skilled through alternative routes. They don't have a bachelor's degree, but they have acquired technical and job readiness skills through many other potential routes, whether it be the military, on-the-job training, training providers who we all, you know, sort of know and love, community colleges, et cetera. And, you know, they are skilled for a lot of roles that are just closed off to them. And so this was an issue even before COVID, right? Then the pandemic hits, and we also, you know, the country starts rethinking racial injustice in a major way. And we start looking at the data and we realize 2/3 of essential workers are also STARS, skilled through alternative routes. Almost 2/3 of Black adult workers in the US are also STARS, right? So like STARS continues to be a critical population then for us in terms of what we want to focus on. So now at this point, what we've done is we've you know, organized our organization in a way where there are 3 basic pillars. So the first pillar is, how do we really inform with data, like the workforce development ecosystem, the power of STARS really is, right? And the kinds of skills they have, the kinds of pathways that they could go into, and help inform employers, policymakers, et cetera, to take that data and actually make change with it. The second part, the second pillar, is what I'm focused on, which is our marketplace for STARS talent. So it's specifically an online platform where employers who have already removed their college degree requirement say that they are being very deliberate about hiring for skills, right? Not just for pedigree. And so hiring for skills, and we connect them with these training providers who have trained STARS and have sort of vetted, you know, their technical skills, their job readiness skills, et cetera. And so it's on this platform then that STARS can have, you know, an unbiased ability to apply for jobs. And then the third platform, or the third pillar, is specifically around our STARS Pathways Collective. And, you know, we are grateful for Walmart and our, you know, grant there to really help us bring people together in the workforce development space, right? So you can think about a pathway being specifically knowing where someone has started with the skills that they have, maybe through on-the-job training, et cetera, helping tie the skills that then they can add on to get to a destination role that does give them career mobility, right? And so then what does that training look like? Who are the training providers who could train on that? Who are the employers who would then hire for that destination role, et cetera, and being able to bring us together around that. And oh, by the way, how does the funding come in? So those are the three main pillars now that we are then accelerating our work on, because we have demand on both sides, right? Both from the job seekers and those who want to hire coming to us as we are looking at a big change in the ecosystem today.
Yeah, so let's stay with that and stay with you for a minute, Kamal. We went from, inequitable and a number of things in the employment sector, but fairly full employment, record low unemployment, to close to overnight, 40 million Americans looking for jobs. How did that change what Opportunity at Work was doing? How do you respond to such a quick pivot and demand in your services? And kind of, many people on the call are facing these kinds of things. Talk us through how that changes. Just as your context shifts overnight, what do you do as an organization?
Yeah, absolutely. So, as an organization, we thought about our customers first, right? Like, what are they going through? What are they doing? And I'll speak to the marketplace very specifically. So it's a three-sided marketplace. You've got the hiring employers, you've got the training providers, and the job seeker stars themselves, right? So the stars are going from, like you said, like the tightest labor market in history to massive unemployment nationwide. The training providers are now trying to move, especially the local training providers, what oftentimes was in-person training suddenly now into remote and online, right? And so this is not only a major operational shift for the training providers themselves, but now as we see it, the stars are also, the job seekers are trying to figure out, do they have the connectivity? Do they have the equipment, et cetera, to be able to learn remotely? And oh, by the way, that job they may have had, may not be there anymore to help them sustain while they're going through the training. And then the third part of that is the hiring employers. And we had initially set out to really focus on SMBs, so small and medium businesses very locally, right? And like you said, overnight, they're suddenly delaying their hiring plans, even putting stops to it. And so, we knew that there was a lot of pain. Now, at the same time, large employers, are starting to say, okay, well, we need to think about hiring differently. We need to think about skills-based hiring, truly putting, our money where our mouth is around diversity. Not to say that there hasn't been good work in the past, but clearly, as we can see, there's more that can be done. And we know that there are some training providers who are seeing the need to sort of rise to the occasion. They're, finding the funding, they're reinvesting in certain ways. And so while we are still there, for the local sort of grassroots growth and ready for those training providers when they're ready to come on the platform, we're also now looking at scale, right? Like, how do we rise to the occasion, and how do we become more enterprise ready for these large companies who want to hire for skills? And then we also have these training providers who do want to scale. They have the ability to scale. How can we go to new markets with them, bring on new skills, new training for them, but also very specifically, how do we help the funding get to them, right? And then that way they can reach more stars, because just increasingly more people are in this world of needing to look for the next thing. And I'll step back and say, we had to make a decision in March when everyone else was sort of thinking, okay, we just need to help people find stability. Do we want to help with baseline stability, or are we still focused on upward mobility? And we made the decision at that point to focus, stay on upward mobility, because what we don't want our stars to be the first out and the last back into the economy, right? And so I think that was really important for us. Let's continue to focus on the skills building and hiring for, the skills that people have, and sort of continue to push on it that way. So for us, it really was like a strategic pivot. It was listening to, our stakeholders, our customer stakeholders, understanding their pain points, and trying to then figure out, well, now what? Like, we know that there are other people who can hire right now, and how do we then help push there?
Thank you. We're hearing a lot about really inspecting an organization's role in the ecosystem, responding to changing context, getting proximate to those who are feeling the pain. Trooper, I'm thinking about benefits, and they are a patchwork state by state. And as we saw COVID relief packages in the early days and various things, there were big changes. You not only had changes on the policy and benefits side, you had changes in that all of this group of people Kamal just talked about now were eligible, many of whom had never navigated benefits before. Can you tell us about how you all thought about change on both your kind of supply and demand side, or however you want to position it, that really needed to be met with speed?
Absolutely. So, when the economy just came to a dead stop, the demand for benefits just went through the roof, and we had to both loosen some of our normal ways of operating. Traditionally, we do our benefits outreach work through targeted matching. So we work with state governments and their files of people on, say, one type of benefit that may be eligible for another, as a way of ensuring that the people we reach out to and who then reach us for assistance are more likely eligible for benefits. And with the economic crisis connected to COVID, we really had to open up our doors much more widely and create hotlines. And really, before, it would have been a lot of people who were not eligible for whatever reason. And unfortunately, we found that with these hotlines in states, that just having general callers, we've had very little difference in terms of the people calling who actually turn out to be eligible. But that also meant that we really had to change some of our strategic goals and focus. And as I said, I have an energetic team, and we essentially took some of our 3 to 5 year goals and doubled them and cut them in half. So it was game on time. And to really say there's so much demand out there that this is the type of moment that Benefits Data Trust was created to be responsive to. But I would be remiss to say that we could not have done this without, frankly, having the infrastructure that was built up over a number of years, without having a depth and sophistication of staff who were able to have the experience across a number of things to be able to weather these changes. And it won't surprise anyone who's watching this who may be running a nonprofit, but that is often tied to the relationships that you have with your funders and the type of funding that you have. And we were very fortunate to be able to have funders who had our back, who offered flexibility where there needed to be flexibility. And I would be remiss if I didn't thank the Walmart Foundation, but others. And that really allowed us to focus on what was best for our clients, what was best for our mission, and to know that we could really make the types of pivots and changes that we needed. And again, as many nonprofits will know, something as simple as having to reinforce your communications infrastructure because you are opening up hotlines, or you need to add a staff person here or there that might not have been in your original business plan or some of your original funding plans. If you don't have that flexibility to do it, you could really be out of luck. So as much as hard of work that this has been, I feel really, really lucky that we were able to do it. And I think unfortunately we foresee this heightened state of demand to be with us for quite some time.
Yeah. And Rita, I was struck as you were talking, the things we forget when the world's changing so quickly around us. But I was struck when you were talking about even that early push where we needed to push to get racial equity data on COVID disclosed. Mm-hmm. And what I think was a suspicion and a fear of all of us that communities of color were being disproportionately impacted, but needing the real data to show that, and the work that had to be done to push for that. I have a colleague who talks about moments of crisis don't necessarily create inequality, but they expose it and they exacerbate it.
Right.
With your 300 affiliates around the nation, you have a unique insight and ability to reach the Latinx community and have a sense of what's going on. Can you talk about how you've activated that to really make sure we are proximate to the issues of the immigrant community as they face this changing landscape?
Yeah, no, thanks, Joey, for highlighting that. I think, one of the big things that we have to ground ourselves is the data. We are a trusted source, and we have a lot of credibility, and people come to us for a number of different things. So we want to make sure that we have that information, and that information is transparent, right? Even today, as I'm thinking about everything in terms of the impact that even Trooper talked about, or Michael talked about earlier, about just our families and the impact that we were seeing personally. That was happening across the country. Today we see communities like in Florida and California and Texas and Arizona. These are all states where half of the US population reside, with the highest rates of COVID. Nationally, and we start Hispanic Heritage Month as of today with a number of celebrations for independence of many Latin American countries. We make up close to 19% of the US population, close to 20%, right? But 31% of all the cases in the United States are of Latinos, and 17% of those have been deaths among our Latino community. So why is that? What is the inequities happening? Why, and that was pretty much the structural racism that you're seeing, the respect for, the lack of healthcare, the lack of coverage, wages, like Kamal talked about, the housing stability, the lack of economic supports. We're one of the largest in terms of essential workers that are going out and working and also have lost jobs. So the exposure is great. And so the challenges are very unique across each of the states that we work with and the priority organizations or areas that we're in. So we needed to really think and make sure that we are talking with the right people and listening and hearing from where, what those different dynamics are. I think tragically, with even, at this, as the school comes, as a school, because I have an 8-year-old that now is in a new pod that I'm just, kind of really, and I think I want to say that I'm very grateful, but at the same time, I sit in a different space, to be able to have a child, to be able to be in that space, but, and you're still as a parent, are very concerned about what does that look like. But even for our Latino children, and youth, they're getting sick and dying at just at higher rates. So these are concerns that we're hearing from not only the parents, the essential workers that I mentioned earlier on, the farm workers, the agricultural workers, and how that looks for them in terms of the rights for not only wages, but also protections of their jobs and the working space that they have. So, I think early on with some of the polls that we did, we saw that Latinos were very much concerned about their health of their families and individuals. This consistently we're seeing this across the board, and unfortunately a reality every day. So one of the things that we've been doing is really, calling out for that transparent data, disaggregated data, that no longer is it, information that you're not being able to dig deeper into the information around COVID and who is really being impacted. But I think one of the big things that I think are common truths that we all have here together is that we all have this collective passion to really restore and recover for, our communities, to really reimagining what that looks like, that it's not going back to normal because we don't want what that normal looks like anymore. I think one of the biggest things, not only in the pandemic, but also during all of this, the racial injustice that occurs every day and still is, it also led us to really think about who we are as a Latino community and recognizing our Afro-Latino, brothers and sisters. How do we support our African-American, brothers and sisters as well? So all that coupled with the food insecurity aspect, the trauma that already was existing, and now recognizing that even today, we have a lot of work to do. I was on a call just last week with promotoras talking about the vaccines and vaccine development and trials and the importance of, if you were to get if a vaccine were to be available, would you get it? And there's a huge level of mistrust and fear in government and officials. And so, and how do you not politicize this? And so we really have a lot of work to do in terms of the education that we need to do, not only with our communities, but also with, health professionals and the government and systems to be collectively, in order for us to be able to recover and reimagine a better future, that it really relies on trust and transparent information. For us, many of the work that our organizations have been in really pushing out the testing, the prevention, the food delivery services, with the immediate direct relief that we received from the Walmart Foundation. In just 3 months, we had over 12,000 school meals delivered, and a lot of the overarching meals also were distributed and delivered to the general population. But even in that breath, the community health workers were able to provide referrals for COVID testing and support to over 12,000 community members to be able to get services. And oftentimes that is really the recognition that in community, you need to rely on those trusted messengers to be able to provide the most accurate information and support them. So for us, there's been a lot of different avenues. The first phase was really standing up a webpage that was both bilingual and bicultural and information around COVID. The second thing was really making sure that we were providing direct relief, coordinating emergency loans through our Raza Development Fund, which supports many organizations to make payroll, to make pay rent, to navigate the crisis, providing hardware, like I mentioned earlier. So I think there is a lot still to be done, as I mentioned, in the next phase of what this looks like, from the vaccines to what the winter looks like for us, what the schools look like as we're starting to see, huge spread again, among our children, where before it wasn't something that people talked about. And so how do we it's a constant reimagining, rethinking, working with our team members, I think, a battle is every day.
Absolutely. I want to come back to some of what Michael talked about. So, each of you at this point is really responding to a health and economic crisis. Your organizations all have equity and racial equity within the core of what they do and have for a long time. But with the murder of Michael Flynn and the real movement that we've seen over the summer, you each as leaders, I'm guessing, faced just as I've probably had the biggest transformation of my organization's ever seen in the last 2 months, we now have this moment. And I'm struck by Michael's call of being willing to do the work, of starting where you are, of really, not blowing this moment, I think is the quote I wrote down. So can each of you talk a little bit about how you layered this into what was already, I don't pretend, a stretched staff, a feeling of, we've done a lot, are we going to get to take a breath? But also a real moment to push towards justice. Trooper, it looks like you came off mute, and we'll let you start.
Sorry, yes, thank you. So it's a very good question, and I think what's interesting is, as a human service, a social service providing organization, that by definition we serve a diverse population. But I think particularly in this moment where there's so much reflection going on, it's important to be honest and challenge yourself to say that just because you are serving a diverse population, this does not necessarily mean that you are meeting the mark of true racial and ethnic equity. It also means that just because you may be an African-American CEO, that your organization is hitting the mark for the African-American community or other communities. So I think it starts with sort of standing in the discomfort of that. But then I think it also means of then getting really concrete and really actionable. And so, you know, I was asked right after the murder and during the early phases of a lot of the you know, uprisings, what should nonprofits do generally? And my first response was stick to your knitting, do what you do best. You know, there are organizations who can be you know, focused on criminal justice, but if you do healthcare first, but make sure that you're doing it in a way that advances racial and ethnic justice, that advances equity. And so for the work, for example, that Benefits Data Trust does, you know, by our work, not only connecting people to public benefits today, but by making the government programs that we have today work better, and our work to make those government programs work better, we are doing our part, and we should do more. We are going to do more to try to undo some of the design of racial inequity and ethnic inequity in government programs without necessarily having mission creep. We were serving, you know, we had the ability to serve many households who chose to, who preferred using languages other than English, in a number of languages. But, you know, during this pandemic, we increased the number of our staff who are fluent in Spanish. But having Spanish language capability, we need to be honest to say, does not necessarily mean that we are truly equitable in serving Spanish households who prefer using Spanish. And so it's really saying that there's a broader, comprehensive amount of work that you have to do and really embed it into the DNA and the infrastructure of the organization. But then balance against all of the other issues, you still have to make payroll, you still have to do your reports, you still have to serve your clients, of really working as leaders and the leadership team of putting it into a sequence and a plan so that you can actually make it work. Because the last thing that any of us want to do is to come, you know, to great events like this and talk about how we're for racial equity and we tweet here and we, you know, text there. But a year from now, we're no longer, we aren't serving communities better than what they had today. And if there's anything we learned during this pandemic, is the hard lesson that we wish we would have done the hard work around better services and equity years ago, so that when a public health emergency like this shows up, we could be saving lives and making sure that communities aren't hit as hard as they have been.
Absolutely. Kamal, Rita.
Yeah, I'll jump in there. So I think the first thing for me personally as a leader was just really understanding that we just had to make the space for everyone. Like, we're all employers, right? Like, we all have people who are on our teams, and everyone is impacted in just the events of the last 6 months in different ways, but it is like we're all tied together by the fact that we're all very human and all very mission driven, right? And we just needed to make the space internally to be able to think through it, talk through it, feel through it. And it really is like a grieving cycle, to be honest, right? And so for some people, it just like, it comes and goes at different points in time. And I think the big lesson for me is, like, even though we are in workforce development and we all have to rise to this occasion right now, and we feel all the more stress to help those who we've been wanting to work, you know, for all this time, even more now, we have to remember that we're all humans sort of on this team working together towards it. And so, you know, we've been really, you know, we've been trying to be thoughtful for the team and how we can make that space for everyone, for people to express what they need, et cetera. And then I really liked what Trooper said in terms of, you know, what is your true knitting? And I think I mentioned that at the beginning, like, we did sort of have that moment, like, what do we want to do? What should we be doing? And I think we decided, okay, no, we're going to sort of stick with this, the focus on stars, right? It does still have all of the overlap and focus on racial inequity that, you know, we now are even more impassioned to serve. And so let's stick with that. And I think part of that is, you know, sticking to that internally as well, like making sure we drop the 4-year degree requirement from roles, you know, as we hire, making sure we are identifying those very, you know, like new and unique places and sources of talent that aren't the normal, you know, like, and I think Michael said this earlier too, like look beyond just the top colleges, right? And let's look at some other sources of talent, and then look at the people inside of your organization and who you can really invest in, and help them on their career pathway too, right? Like there's first and foremost, your immediate community really is your organization, and what can you do to impact change even just within that? And then obviously, you know, being able to translate that outwards. And so, you know, I think what I'll say is we're just so sensitive, and Rita said, you know, we don't want to go back to normal because normal was not good. And what we're very sensitive to is what, you know, our CEO Byron calls like the K recovery, which is people who do have college degrees being able to come out of this, you know, with economic, you know, mobility upwards, but those who don't, having a prolonged economic recession, right? And so really just trying to reinforce that for everyone, like it's really important, obviously, to think about stability for everybody and getting them into jobs. But if you are in the position to help with getting someone into, you know, middle skilled, middle waged role who wouldn't normally have that opportunity, we need to be opening those doors now more than ever.
Absolutely. And Rita, as a civil rights organization, really from the founding, can you talk about how the last few months have changed the internal conversations at UnidosUS?
Yeah. So yeah, I mean, I think we were created for, you know, to have a just world, right? And for us, it also was providing that space, not only for our team members and their staff, but be able to not reflect on what we know, what we don't know, recognizing, you know, how can we learn? Not just trying to look at checking a box about, you know, unconscious bias training or anything like that. It was more on listening to each other and bringing up, because I think everything that happened, a lot of our own experiences was, you know, that you kind of kept, to some extent, at least for myself, kept it at a lower space, you know, because I needed a lead, came flushing out, you know, in terms of being able to say, this is when I was discriminated in college on this level, or where my father, who was a farm worker, you know, did not have the resources to eat or, you know, live in a better world. You know, all these things just came up, and then also recognizing the color of your skin and who you are and how you were portraying yourself to others. And I think, you know, what was great about our organization is that Janet and our CEO, Sonia Perez, were very clear about providing that space for us, listening to the different generations, you know, the younger generation to the older generation, and then also recognizing that how do you talk to your own family about how we speak about racial justice and discrimination and racism. I think that's where, for us, you know, where it's a constant change and an evolution and a learning that we needed to do. I think, you know, because we're humans, like Kamal mentioned, is checking in on each other every day to see how you're doing. I know I have, you know, early on I was having almost daily calls because we were in rapid response. And now I check in with my team about 3 times a week in the mornings just to see what's going on, how are you doing, where are you in your space, right? And then how do you, you know, because we ourselves are going through all this other personal loss and grief and worry. And we take on a lot also on what we want to do for our organization. We're very mission driven and purpose driven. So I think for us, you know, one of the big things is recognizing that our values are important, that we sit in the space of, you know, our common purpose, that we're supporting each other. I think if anything, our organization is stronger because it's very true to we internally talk about familia and the importance of familia, but at this moment in time, it really showed of being able to check in with each other. And it was hard because we love to hug and kiss and be able to connect with people, and that wasn't the case. So we had to find new ways to do that.
Absolutely. And in our last, we have about 5 minutes. In our last minutes, we've got a group of incredible leaders on the call. And you've all talked about really addressing this. And as they are thinking about whether it's at a local organization or a philanthropic organization, you know, the span of the independent sector. And Rita, I think you kind of leaned into this at the beginning. How are you changing as a leader? What are the things you're learning as organizations that had to pivot quickly? That those that might have been thinking really about, okay, what's the change I need to think about now? What would your advice be as we wrap up? And anybody can start.
And I could start just because I'm unmuted, but I think the big thing that we've been speaking as leaders here at the table, right, and those that are listening today, is a lot of self-reflection of how are you leading in crisis, right? And I think being able to trust your own judgment, recognizing your values. Where do we, you know, this, I think somebody mentioned it when Michael was speaking about this value-driven leadership. And I think that's, you know, by doing the work, by listening, by understanding, weighing your options before you shore up your organization around key areas. I think that was, you know, something that Kamal and Trooper both talked a lot about. Communicating frequently. I think that's super important because we get busy in our work and then we're saying, well, why aren't we doing more of this? And we have been doing it. So I think that's important. I think people, you know, oftentimes fear and anxiety raises when you don't have all the full information. So communication is key, and being focused. And you know, for us, it was really making sure that everybody was focused and activated in an urgency of the moment. And recognize what are our goals, you know, how we needed to pivot for health and the economic impact that this was making for our community. We're continuing to pivot now on the civic engagement and making sure that our voice and power it continues on. I think this task isn't easy. It depends on the organization and how complex the organization is. But I think individually we have a role to be able to bring that strength in within us, that hope, you know, that lies for a healthier, more equitable and just future for our country and for our communities.
I would say that, you know, it's holding in balance the focus on the mission and having the impact, maintaining high standards even during such tumultuous times, but you know, in many ways, as a leader, being strategically kind about how people in your organization and how your organization, the routes they take to reach those standards and to have impact. You know, in mission-driven organizations, we, by nature, and we attract people who are hard-charging, who want to get things done, who want to make a difference. But sometimes we can be unkind to ourselves, and we can burn the candle at both ends. And while, you know, even in more traditionally normal times, non-COVID type times, that's something we generally need to address. But I think especially at a time like this, when people are going through so much and they are trying to give so much, that we all have to really make sure that we're going to push because we care about the mission, but we have to make sure that we protect our people. And in some cases as leaders, that means being extra purposeful about you know, when things may go a bit wobbly, of sometimes just letting it go in the tactical sense, and then correcting it in a way that you might not have before, because, you know, everyone is sort of coiled really tight, and we just need to recognize that and sort of protect protect our people during these times.
I love both what Rita and Trooper just said. I think that being kind to yourself piece resonates a lot with me. I have a 3.5-year-old at home and a 1-year-old, but I think, you know, we talked to her a lot about that. But personally, as a leader and as a mom, and many of us, you know, as caretakers, one thing we have to remember, I feel like at this point in time, is you do have to find a way to be kind to yourself, because then you're going to be strongest to help everyone else who you are trying to help, whether it's internal to your organization, external. And like, I'll be very personal, I'll share, like, I literally wake up 10 minutes earlier just to have 10 minutes of time in my day for me to read or do anything creative, right? because that mentally then just allows me to say, okay, I feel now good to give to everyone else. And then I think the other thing that I'll add is just as, you know, maybe it's because we're a little bit younger in the space, but I think one thing that we're very thoughtful of right now is not only our mission, but as we continue to think about the stakeholders who we're trying to serve, how are we best placed to serve them, and who else can we do that with, right? I think just coming up for air and out of our own silo and just saying that who else complements what we can bring to the table, because now more than ever, our stakeholders need us the most. And I think that's been a very deliberate conversation in our organization. And it kind of speaks to like the Pathways Collective and the marketplace being an open marketplace, et cetera, knowing that we aren't the perfect solution. We know our stakeholders of 70 million stars have had hundreds of thousands of different pathways to get to where they've gotten to. So there's not one perfect solution. So then what is that combination of solutions to work together for who you're trying to serve, right? So yeah, I think that's the last thing I will add.
Thank you. I just want to thank each of you for being willing to share, share how your organization is changing, share how you're bringing to life really the challenges we heard from our last speakers. So we can all learn a lot about you and from each other.